Critical care nursing exam is very interesting. It requires critical thinking and it requires mastering content in the very smart way. Adapting class get you back. These questions are ideal, designed to test your critical thinking at the same time prioritization. Stick around. Let me help you pass these exams. First question, of course, prioritization. You have to be sharp. If you have 1 second, what would you do? As a critical care nurse, you have 4 patients. And if you have 1 second, who would you give it to? Look at the situation and look at the modifier for each. Divide the question into two. And then look at what each one of them have. Forget about the initial problem. Look at the second aspect, what is happening. We have atrial fibrillation. Okay, and so what? His heart rate is what? 112. And he's scheduled for what? TEE in 30 minutes. Atrial fibrillation, his heart rate is what I expect for any patient who has atrial fibrillation. I don't expect anything else except what is being given to me. There's no evidence of shock. And the patient is going to have what? He in 30 minutes is stable. I'm not worried about it. He's scheduled for procedure. I have a patient who has a chest tube after cabbage. He's draining 150 ml of bright red blood the past hour. What it means is you have to be careful. 150 ml in an hour, that is too much. It's greater than 100 ml per hour. That requires special attention, and that is what I call you have to be sharp. If you have 1 second, this patient, it looked like he's sicker than this guy. It's an unexpected finding, not an expected finding in a patient having a chest tube. I got to worry about it. 24 hours after post-MI, after heart attack, and you have 2 out of 10 mild chest pain that is relieved at rest, that is stable, right? Stable angina. You don't have to worry about this patient. A history of what? Heart failure, asking for PRN dose of what? Furosemide for mild leg swelling. Yes, heart failure. What is he doing? Asking for medication. Furosemide is because what? Pulmonary edema or what? Leg edema. The patient has leg edema. If they have pulmonary edema, it becomes a priority. Leg edema is not the problem. So I'm going to ignore that. Therefore, who has my second? Who has my priority? It's number 2. Who is pouring out chest tube 150 every hour is not something I should expect. Therefore, I'm going to pick number 2. Test taking strategy, easy way to master your critical care nursing exams. These cardiology questions are very intimidating. Forget about it. Don't worry about it. Look at the way it's written. Think about it. Go for the buzzword. Read it from the back and ask yourself, what are you going to do? Which of the following is the most likely cause of what? Hemodynamic finding. What does that mean? What are those value means? They are very intimidating, but you got to put them together to make sense out of it. That is the easy way to master this kind of hemodynamic numbers that they will give you in cardiology. They are not that difficult. Trust me, if you pay attention to what? The buzzwords. Let's go for the buzzwords. And let me show you what I mean by the buzzwords. You said what? Most likely. Then read the question. Make sure the stem of the question give you something on the values. The patient what? Has inferior MI. This is the heart. The lower portion of the heart is diseased now. That means it's infected. Suddenly, patient develop what? Bradycardia, something is wrong, and hypotension due to the MI. And the clear lung, this is a buzzword. Now look at it and make sure it meets all these criteria. The pulmonary artery wedge pressure, pulmonary artery catheter shows what? A CVP of 16 is too elevated. CVP is too high. Your wedge pressure is normal. That is why the patient lung is clear. That means the left atrial pressure, feeling pressure is normal. When the feeling pressure is normal, there should be nothing from the ventricle. That means there's no problem from the left ventricle. Based on that, I can just eliminate this right away. You see the way I'm approaching it? I have a normal wedge pressure and I have a normal what? Left atrial pressure, feeling pressure. Therefore, my ventricle pressure should be fine. The MI did not affect the left ventricle. The cardiac output is not great, right? Cardiac output is not great. It's too low. Therefore, something is not filling the left side. We got to bring more fluid, but it's backing up on the left side, on the right side. That is why the CVP indicated on the right side. It gives you idea on the right side of your heart. So the CVP means blood is backing up in the systemic system and vascular system. And therefore, on the right side of your heart, things are full, right? That's what you're seeing. It can be cardiac tamponade because if it's cardiac tamponade, they will give you something. What are they going to give you? They will give you the blood pressure, but they will give you narrow pulse pressure. They will give you a sound, the heart sound. They never give you the heart sound. Patient may be tachycardic. It's not going to be bradycardic. Hypovolemia. Yes, well, your systemic vascular resistance will go up, but your CVP is not going to go up. You see the way I'm breaking its answer choices? That means it cannot be hypovolemia. It has to be right ventricular infarct. And this is a concept you have to know. I use the questions to teach. When you have inferior myocardial infarction, expect right-sided heart failure. Therefore, this is your right answer. Okay, so that's your right answer. The last question is a rapid fire. Is what? The last question is the same strategy. Let's look at it. Same strategy. A patient, what? A patient with sepsis, I told you is patient, I've given you an idea. It's receiving norepinephrine, but remain what? Hypotensive. That means the norepinephrine is not helping. Repeat hemodynamic reveal what? CVP of 10, right? We have CVP of 10. What does that tell you? CVP of 10. Wedge pressure of 14, right? SVR is 700. And the cardiac output is too high. That's your key. A high cardiac output, that means I don't need to give the patient fluid. You see what I've done? A high cardiac output, I don't need to give the patient fluid. The CVP is normal. I don't need to give the patient fluid. Patient has sepsis. Look at his SVR is so low. Systemic vascular resistance is so low. That tells you this is a distributive shock. Patient is in shock. Even though the cardiac output is too high, indicate sepsis because the patient is in sepsis. The SVR is too low. So you have distributive shock with the high cardiac output, low SVR, and a persistent hypotension. Once again, distributive shock is high cardiac output, low SVR, and a persistent hypotension, even though you're giving them vasopressin. What would you do? You're giving them norepinephrine. Even though you're giving norepinephrine, what will you do? Add another medication, pressor. So vasopressin is what is going to help with the SVR, and that is going to increase the blood pressure and improve myocardial oxygen demand. Dobutamine is not needed because what? The cardiac output is too high. Dobutamine is ionotrope. It will give you more cardiac output. Your cardiac output is already 8. The norepinephrine and then is already maxed out. The patient is receiving norepinephrine and still the blood pressure is too low. Increasing it is not going to help you. Giving them fluid at this stage is not going to help because the blood pressure is the CVP is high, cardiac output is high, but you need to squeeze them first, right? In this situation, since you've given him the norepinephrine and it's still not helping, add another pressure. The next one is vasopressin. So the right answer is number 1. So to recap, this patient is in distributive shock with a high cardiac output and low SVR and what? Persistent hypotension. This is a diagnosis of distributive shock. What do you do? The big word is norepinephrine, but remains hypotension. That is your clue. That's the buzzword. That means you should add another medication, and that is vasopressin. Thank you for watching. If you like this video, put a comment and subscribe to Adapted Quiz for more IU content regarding what? Critical care nursing exams, focusing on cardiology. Take care of yourself and good luck.